Cupping is a technique that I use with around 60 to 75% of my clients. It can be really effective at helping to just give an extra layer of work to the soft tissue around the joint spaces. It's a great myofascial technique, meaning that it'll work on both muscle tissue as well as connective tissue. Connective tissue, which includes things like ligaments and tendons, can be more plastic in nature and usually doesn't respond just as well to the different massage therapy movements that can be applied to muscle tissue. So using cupping can be just another technique to help open up the joints, get better mobility, reduce pain, bring greater blood flow, and release adhesions or stuck layers of tissue that are bound up in injured areas or areas of the body that have range of motion restrictions. So I'm going to demonstrate what cupping looks like. First of all, I'll kind of show what a cup looks like. Pretty simple, just looks kind of like a little fishbowl turned upside down glass object that goes on the body. The way that the suction force is created is by inserting a flame inside the cup, and then it goes right down on the surface of the body and creates an upward suction force, bringing the surface layers of the skin and soft tissue into the cup. The style of cupping that I'm trained in that I do is called fire cupping. So I'll just kind of give a brief demo of how we do this here. Okay, so if we're going to treat a shoulder on someone, generally I'm aiming for specific acupressure points around the shoulder that I'm going to be placing the cup. So in this instance, we're going to place the cup right here. And one more cup here. We're going to treat kind of this rhomboids group. This is essentially how the cupping techniques work. So as you can see, they're on there pretty firmly. Normally I leave the cups on for about 10 minutes, sometimes a little bit longer. There's techniques that you can certainly do beyond just these stationary cupping techniques with the cupping. Another one would be to apply oil and kind of move it around muscle groups, which I will also sometimes do. Just to show quickly, one other cup that I sometimes work with for smaller joints that are harder to cup with the glass cups would be these silicone cups, and they're super gentle and easy to do. You just pop them on the body, there's a little suction force, and so, for example, if I wanted to treat wrist pain as well as shoulder pain, I might switch it up and use some of these blue silicone cups to work with the smaller joints. Generally, when I do cupping in a session, I'm working an area with the cups while I'm actually moving somewhere like the low back or the arms or the legs, just a different part of the body, to kind of integrate that into a continuous treatment session. So that's my demonstration and explanation of cupping therapy.